In this morning's Health Watch, fighting Alzheimer's with food. Alzheimer's affects 5.3 million Americans. There is no cure, but there may be a way to help prevent it. This is a big story this morning. Our Dr. Jennifer Ashton is here with some new research. Good morning.
Good morning, Harry.
And what is the headline here? You're talking about a 40% lowering of risk for Alzheimer's by doing simply what?
Eating well. Let's talk about this study. It was done out of Columbia University. They looked at over 2,000 people in the New York area over the age of 65, followed them for an average of 4 years, and found that those who ate a relatively healthy diet, and we'll talk about what that means, had up to a 40% reduced risk of developing Alzheimer's.
Do you know how big a headline that is?
That's huge.
Alzheimer's affected my father, my father-in-law. Every family in America has been affected by that. If you could roll it back by 40% just by eating differently?
And like any other disease, Harry, much better to prevent it than to treat it once it started. So what they found was that not just specific foods, but foods in combination with each other had a protective effect. So we're talking about foods that were high in vitamins E and B12, high in folate, and high in omega-3 fatty acids. So as most people know, those are things like nuts, fish, especially salmon or oily fishes, leafy green vegetables, things like broccoli, very protective.
And these are the things that we talk about on a regular basis as being heart healthy and all these other kinds of things. So basically, if you're on this line of food, it's going to pay all kinds of dividends.
Now, we don't want to take all the fun out of life, but the bad diet per se, things like high in butter, high in cheeses or brie, which I personally love, high in red meat, again, we're not saying never, but in moderation.
Is there anything else in the research about quote-unquote lifestyle factors?
Look, the things that are good for your heart are also good for your brain and vice versa. So you want to keep your weight down, minimize tobacco, alcohol use, and exercise, all protective. And again, this isn't the only piece of the Alzheimer puzzle, but it's probably a big part of it.
Boy, that would, you would certainly think that would be a red flag for a lot of people. If this is really predictive, and I'm sure this is going to be gone over with a fine-tooth comb.
Exactly.
If this is really predictive, it's a huge, huge headline.
Very important, and it's important to start early.
All right, let's talk about this other sort of significant study done with Alzheimer's and driving. What is the headline here?
Listen, this is a critically and very difficult decision that many families with someone with Alzheimer's are going to have to make, when to take away the keys. We know that people with Alzheimer's and senile dementia can be at greater risk for motor vehicle accidents, and it can be difficult to know when you do that. The bottom line here is it needs to be individualized. This is not a black or white issue, but there can be some signs. For example, if you have an older person who's putting on less miles as the time goes by, so they're not driving as frequently, that might be one sign.
That would be an indication to you as a caregiver or
you might want to
one.
reevaluate how often they're driving. If they're avoiding certain driving situations, such as they don't like driving at night or in rain or bad weather, if they're having little fender benders or increased accidents, getting minor violations, or they're having aggressive or impulsive habits, that's not someone you want behind the wheel, and that can be a very difficult decision to make.
Is there like a test or something that you could say, Dad, we need to take you to so-and-so that...
There's no one definitive test, Harry. It's a combination of factors, but you want to talk to your doctor and get behind the situation before it becomes a problem.
There you go. Dr. Jennifer Ashton, thank you very much.
A lot happens early on The Early Show, weekday mornings on CBS.